I mean, it's always always a pleasure to be around with a young, dynamic, vibrant, and very learned audience. Of course, I've been doing it for the last only 40 years. So, at this stage, I don't normally get into these lectures, but this was a very important session. I mean, people should understand that depression, like someone just mentioned, that depression has become the order of the day in this country for more reasons than one. Depression has become the order of the day in this country for more reasons than one. So what I'm saying is we are all depressed in one way or the other. But then today we are not talking of the simple depression. Now I'm a neurologist and I've been practicing for only 41 years. And when I started in 81, there were only 2 psychiatrists, 5 in Pakistan, 2 in Karachi. So we were all psychiatrists. So we were all dealing with tricyclic antidepressants, and so we did not have the approach to psychotherapy. But today things are totally different. Now the way the world is advancing, I mean, we are really moving on. We are talking of neurotransmitters. We are talking of pathological depression. You know, about 35 years ago, I was talking to my professor, Dr. Ahmed. He said, these patients were not going to get better. They have pathological depression. I said, what is pathological depression? But now, with the advent of these latest machines and gadgetry and imaging procedures, we know that there's something called pathological depression. So coming to the association of depression with neurological disorders. I mean, every neurological disorder, especially the neurodegenerative ones, will definitely have depression because the quality of life has been hampered. You are not the same anymore. They're so important. So the thing is, whether you're suffering from multiple sclerosis, whether you're suffering from any other disease like Parkinson's disease or even Alzheimer's disease, and most of all, patients who have a very short lifespan like motor neuron disease. And of course, since I've been doing pediatric neurology for the last 20 years now, even children have depression. Now coming to one thing, I mean, before we go any further, I've been looking at tension type headaches and migraine for the last 40 years. But remember one thing, the intense headaches that will disturb the individual are not tension type headache. Which is the commonest headache? Can anyone tell me? Which is the commonest headache? Can you tell me?
Tension.
He's saying tension type headache. Anyone else?
That's what you read in the books.
That's what you read in the books. Wow. Anyone else? Can you tell me the commonest cause of headaches? यार कोई कुछ बोल नहीं रहा, बात क्या है? हाँ बोले. No, so see, let me tell you. I'm only referring to 2 headaches. I'm only referring to, of course, there are so many causes. I'm only referring to migraine and TTH or tension type headache. He's right. Tension type headache is the commonest headache. जरा सुन ले बड़े गौर से सुन ले, ठीक है? Because I'm the first man to do a public population-based study from Pakistan. So we are only 7 countries now. We finished with the WHO and the burden of headache study 8 years ago. 8 young doctors from Dow University of Health Sciences were able to complete, and we shocked those guys. Tim Steiner, the man who has written 400 papers, came to Karachi 3 times just to see how bright these medical students were. So we have a lot of potential for research in this country. Coming to all these diseases, they can all cause major depressive illness. But then, is this simple depression or is this a major depression? So what's the difference? In major depressive illnesses, the patient is not only depressed, he is agitated, he is suicidal, and he is cut off from the environment. He is suffocating. So that, but now with the advent of newer drugs, vortioxetine, of course, with the advent of newer drugs, there is now a treatment for even major depressive disorders. This is very, very important because we need to address these. So let me tell you, for the young doctors who are into neurology, what is the major difference between a tension type headache and migraine? You must know that. See, as a matter of practice, migraine is always intense. I mean, you can question me on that, but I have 40 years I've been teaching. I'm now in America based. We are basically based in El Paso in Texas. So the thing is, now you should understand this. लोग मुझसे पूछते हैं कि सर 40 साल से आप सर के दर्द देख रहे हैं. The major difference between tension type headache and migraine is the intensity. Tension type headache is not disabling. वो आपको तकलीफ दे तो होगा, लेकिन एक खातून आके मुझसे कहती हैं कि मैं 1 महीने से मुझे सर में दर्द है. लेकिन मैंने कहा then can you do your routines of life? Of course I can. I have had headaches for a month. I can still work in the kitchen and it does not disturb my routines of life. That is tension type headache. लेकिन अगर माइग्रेन के अटैक्स होंगे, they are disabling. आपको पता है बात हो रही थी शादी की. I have seen over the last 41 years 250,000 patients. Over the last शादी के बाद, I'm telling you something very important. A gentleman came to me 20 years ago and said, "साहब मेरी बीवी बड़े बहाने करती है. रोज वो कहती है सर में दर्द है, रोज वो कहती है यार ये कौन सा सर में दर्द है, मैं तो उसको छोड़ रहा हूँ." And would you believe it? He actually left her. And you know what she had? कोई बहाने नहीं कर रही. She had migraine attacks. Disabling migraine attack, कोई बहाने नहीं कर रही थी. When you have disability with migraine, you cannot work. You can have status migraine. I've seen patients having migraine attack for a week. Status. So मैं ये बताना चाह रहा हूँ कि the difference between migraine and tension type headache is the tension type headache is going to disable your lifestyle. It's going to derange your lifestyle. So जब बात हो रही थी कि which is the commonest headache, of course the commonest headache is tension type headache. लेकिन वो कौन सा दर्द है जो आप बार बार देखते हैं? The commonest headache that reports to a neurologist is migraine, because tension type headache is not going to provoke you to go to a neurologist. The tension type, like you can do the routines of life, but a disabling migraine attack will disable you. You won't be able to do. You won't be able to go to school. A woman will not be able to go to the kitchen. A man will not be able to go to work. तो इसमें माजूरियत हो जाती है जनाब, माजूरियत. This is very important. तो जब आपको कोई पेशेंट आके कहे कि साहब मुझे सर में दर्द है, 2 हफ्ते 3 हफ्ते हो गए, हमने यार स्कूल जाते हैं जी, आप काम करते हैं जी, it's most likely not migraine. Of course, you can go to through the criteria of migraine, phonophobia, photophobia, nausea, वो सब कुछ, throbbing headache, character of headache is very important. तो मैं ये कह रहा था, this is extremely important, even for the most experienced professors who are sitting here. I must tell you that you have to differentiate between tension type headache and migraine. क्योंकि आप अगर migraine के patient को, if you give them these antidepressants, of course tricyclists do work, they are not going to work. See, in the US, you inject them, एक injection लगा दिया, 75,000 rupees का मिलता है यहाँ पे, pain is gone for a month. But if you control the diet is so important. I'm telling you, diet is so important. If you control the diet, dairy products, वो सब ठीक कर लें, खाना ज़रूर खाएं, carbohydrates is the most important thing to do. तो मैं कहना ये चाहता कि you have to have a good diet, आपकी activity को कम करें migraine के attacks को, and you have to differentiate between migraine and tension type headache. The other important thing that I would like to discuss here is, so coming back to what I asked my professor 35 years ago, 3.5 decades ago, कि साहब उन्होंने कहा यार आरिफ यार पैथोलॉजी, अगर पैथोलॉजिकल डिप्रेशन हो तो कैसे ठीक करेंगे? पैथोलॉजिकल डिप्रेशन कैसे होगा? Yes. So the neuropathic hypothesis of depression are very important. See, the way things are moving, I mean, the way research is going, you know everything. We almost discovered the treatment for Alzheimer's disease, but it has gone the other way around. I don't know if you know. We have a research cell in El Paso. So what is important is that now, with the advent of new technology, with the advent of the modern imaging, volume of the hippocampus, the volume of certain parts of the brain, take it that way, has been shown to be reduced in patients with depression. I mean, this is so important. I would never believe कि साहब depression से structural change brain में हो जाएगा, but होता है. I mean, you've been studying there. And so what is important is what happens. When you have depression, you have two types of toxicity. You have glucocorticoid toxicity, and of course you have glutaminergic toxicity. And of course, then there is a decrease in the neurotropic factors and of course neurogenesis. So imagine, जब हम कहते हैं कि depression causes neurological disorder causes depression, it is true. It is now being proved without doubt. So this is what the development and the research has been doing to neurosciences. And it's so important that the stress, we'll also be talking about the brain-derived neurotropic factor. This is the modern thing. Brain-derived neurotropic factor, which is BDNF. Now what happens is that this factor is reduced in stress. And they've actually shown now that when you give these patients antidepressants, this factor increases. So there is a very important link between depression and brain damage, structural damage in the brain. That is why it's so important now to treat depression as early as possible. Otherwise, you could have post-ictal or post-depression cerebral damage. I think we'll stop here and we'll take